Mental health issues are now reportedly one of the largest health problems across Australia. Statistics show that over 3 days per year per staff member are lost because of problems attributed to workplace stress. On top of this, stress-related workers' compensation claims have doubled in recent years, now costing over $10 billion a year. For more on the cost of workplace stress for businesses, Joydeep from People and Culture Strategies joins me now in the studio. Joydeep, thanks so much for coming in. Good to see you. 1 in 5 people likely to be affected by mental illness at some point in their lifetime. That's sort of a statistic that workplaces really can't ignore.
No, exactly, and I think one of the biggest challenges for businesses when it comes to dealing with this is that a lot of the cost and a lot of the impact is going to be felt by the business well before they have any idea that there's a mental health issue that's probably the trigger or cause behind it. And I think the biggest danger for business, and what I worry about, and I think a lot of businesses need to worry about, is what will be the steps that they take, for example, in managing an employee's performance, which they might identify as being underperformance, completely oblivious to the fact that one of the catalysts for that underperformance or perceived underperformance might be a serious mental health issue, whether that's depression or some anxiety disorder or whatever else. And you can just see that a manager, particularly vigorous, wanting to deal with those kinds of performance issues, perhaps getting a bit of pressure from that person's bosses, and quite inadvertently perhaps setting in chain a course of events that could have some very damaging consequences, not just for the business, but also for the individual and other individuals in the organisation.
Where does the responsibility lie, though, to identify the problem? Is it with the business or is it with the individual to come forward to the business?
Yeah, look, it's a very good question. I think that under occupational health and safety laws, for example, it's very clear that employers have the fundamental and primary obligation to try to come to terms with what might be the risks to any person's health, safety and welfare. And naturally, a part of that requires them to tailor what they do or don't do to the particular circumstances of an individual, including their health conditions or otherwise. Having said that, we all know that something like mental health or depression is for so many people a very private and personal issue. They're not going to be as forthcoming about it. It's not going to be as obvious as, for example, someone who has a physical disability or condition where everyone can probably see or hear or observe the nature of the condition. So it's I think, for employers, the challenge is creating the right environment to ensure that these kinds of issues can be comfortably ventilated by an employee without fear that the moment they do so, they're going to somehow be earmarked as someone who will never go anywhere in the organisation.
Absolutely, because there's sort of a difference between some people going through a bit of a blue patch and then some of these, really deeper-seated issues, whereas a lot of corporations wouldn't even have sort of the idea how to identify that or how to even, move forward from that point. So where is sort of the first port of call? What's the first step in putting these sort of systems in place?
Well, I think for starters, employers and those in senior management at board level need to make a very strong commitment, both from a supportive point of view in relation to dealing with these kinds of things, but also making it very clear that in the event that an employee wishes to raise issues as to their own condition or health, there's a confidential mechanism where they can do that without fear of repercussions. And so there's an infrastructure that has to be built around that. I think the other challenge for employers, even those who have been very good at setting up that kind of infrastructure, is the proof will always be in the pudding. And the last thing an employer or a business can afford to happen is for someone to utilise that infrastructure and share the confidences or share the confidences of an HR person or whoever it might be within the organisation, only to see that as a result of so doing, they've been victimised, they've been marginalised, they've been isolated from other training opportunities and whatever else. And if that happens, there are some very hard legal consequences for businesses as well, particularly under the new Fair Work Act, where the government has introduced what are referred to as general protections, which basically will pretty much automatically result in employers being capable of being prosecuted for breaching their obligations under legislation. The argument is that they have treated someone less favourably as a result of them having a medical condition, in this case a mental health condition.
So that's all about creating a culture where people can come forward without risk of repercussion. What if it is the case that it's actually the culture of the business itself that is contributing to some of the underlying problems? I mean, where do some of those issues come in as far as perhaps compensation or actually changing the culture of an organisation?
Absolutely, and I think particularly in the last 12 months we've seen the whole issue of workplace culture come under an enormous amount of scrutiny, and a lot of that scrutiny has been in a sexual harassment context, for example, with some notable high-profile cases in that space. So what we are going to see increasingly over the next few years is that organisations won't be able to hide behind the veneer of, well, that's just our industry, or that's just our business, or even that's just that individual person or manager that we've got within the organisation. Courts and tribunals are going to say it's not good enough. As an employer, you've got clear obligations to take steps to fix that culture, and indeed fix that person who might be contributing to that culture. Now, all of that needs to happen in a fair way, consistent with an employer's obligations, but it's got to happen. And the scope for excuses for employers and businesses in this day and age is becoming less and less.
And, you know, likely businesses will want to take a handle of this, costing over $10 billion annually in lost productivity.
Yeah, so there's been a lot of studies done, and a lot of that's come from the workers' compensation impact. So a lot of insurers have looked at how much is this affecting businesses, and you get to those kinds of figures, and it's not surprising.
Now, Joydeep, you are hosting a webinar. PCS, People, Culture and Strategies, is hosting a webinar. If businesses are interested, how do they sort of get into that?
Yeah, so full details are available at our website, peopleculture.com.au. It's Tuesday the 8th of February, midday Eastern Daylight Savings Time, and the focus of that is very much to give businesses the strategies and solutions to deal with this very difficult and complex issue.
All right, Joydeep, we're tight for time today. Thanks so much for coming in. Joydeep Kaur joining us there from People and Culture Strategies. We have to take a short break.